Welcome to video 2, How to Give Advice to Patients, in the series English for Medical Purposes. In this video, it is explained what language to use when communicating in the workplace and with patients. By the end of this video, you will have learned more about the prerequisites for giving advice to patients, what to say and what statements to expect to be used by patients. You will also have practiced a scenario. Here we go. Pause the video here, look in the description box and answer the question in A. First of all, let's discuss the prerequisites for giving advice, which means everything you need to do before you actually can start giving advice.
5 prerequisites. Listen carefully.
1. Assess the patient's needs first. 2. Assess how well your patient is able to process new information. 3. Make sure to be familiar with the patient's living and working situation. 4. As well as with their social environment. And 5. Make sure to be fully informed about the treatment and advice that's been given so far.
Pause the video here, look in the description box, and answer the question in B.
An overview of the prerequisites. Phrases to use when interacting with the patient. What seems to be the problem, sir? What seems to be the problem, madam? How long have you been suffering from this problem? Does it hurt? When does it hurt? And what sort of treatment have you tried before? Do you have any other complaints? Pause the video here, look in the description box, and answer the question in C. Phrases to expect when interacting with the patient.
I don't feel very well.
I've been very ill since.
I have terrible pain in.
My child doesn't want to.
I've been suffering from... I can't seem to use my...
My medication doesn't seem to work. My medication is expired. My medication is completely finished. Over to you. Practice a conversation between a nurse and a patient using the language discussed in the video. The scenario. A patient wants some advice about different incontinence products. As a nurse, you discuss the following products: special bed material, including covers, sheets, and pads, and incontinence materials like diapers, nappies, and plastic pants. If you don't have a partner at the moment, script out the conversation on paper. Ask for a partner in the comment section as well. This will help us build a community together in which we can practice these things.
Pause the video here, look in the description box, and answer the question in D.
In this video, you started to learn about the prerequisites for giving advice to patients, about what to say and what statements to expect to be used by patients. And finally, you've started to practice a scenario together or have scripted one out. We'd love to hear from you too, so we really appreciate it if you could share some of your own experiences when interacting with patients, for example, or with clients. And if you have any additional prerequisites to add to the list that we've presented and talked about today, we'd really appreciate it.